Good evening, everyone. Welcome to another edition of FICCI Fights COVID. This is our twice a week bulletin on COVID, where you can log in and ask your questions pertaining to your concerns about COVID. Today, our guest is Dr. Lancelot Pinto. He is a consultant pulmonologist at the PD Hinduja Hospital and Medical Research Center. Welcome, Dr. Pinto.
Thank you, Dr. Malhotra, and thank you to FICCI for organizing this event and inviting me as a speaker.
I would just like to introduce, I would like to tell the audience that Dr. Pinto is a gold medalist at his DNB examination. He specializes in respiratory diseases. He is also trained in epidemiology, sleep medicine, and COPD rehabilitation from the McGill University in Canada. He is a keen researcher with more than 70 peer-reviewed publications and is also a peer reviewer for a number of leading journals. He has been a consultant for the World Health Organization, the WHO, and the USAID as well. His main areas of interest include drug-resistant tuberculosis, smoking cessation therapy, management of sleep disorders, and I believe for the past 2 years, management of severe COVID. Welcome once again, Dr. Pinto.
Thank you.
So, we have questions coming in from the audience, and I would like to dive right into it. The first question is that the precautionary dose is available to a select group of people. Who are these groups of people, and how does this help these patients in cases of Omicron and the other variants?
The precautionary dose is available right now to frontline workers and individuals over the age of 60, especially if they have comorbidities. And the concept is that the precautionary dose has been shown in studies to prevent the progression of mild COVID into moderate to severe COVID. So some individuals, even after the precautionary dose, might get infected, but the aim is not just to prevent infections, the aim is to prevent moderate to severe disease. And there is enough data to suggest that when given to the right individuals, there is a significant protection that is offered with the precautionary dose. So one would not want to give this dose across the board to everybody necessarily, but individuals whose immunity is low and therefore may not have mounted a very strong response to the initial vaccination are the ones who will possibly benefit the most from the precautionary dose.
Thank you. Also, there's a lot of concern, with, decisions of opening the schools and the schools getting shut down again. So the next question is around that. So the audience is asking, how does one protect the younger children from getting infected? And how do you see the role of vaccination in children? Also asking, how do you propose that, the parents react to the schools reopening, and what's your take on that?
I think we now have close to 2 years of data when it comes to COVID, when it comes to the infection with SARS-CoV-2. And in the 2 years of data across the world, across different countries, we've seen that children seem to be uniquely protected in some way from moderate to severe disease. So children do get infected, possibly at the same rates at which adults get infected, but for some reason, most of them, 99.99999% of them, tend to have a very mild disease which just lasts a day or two. They have a little bit of a fever, they have a little bit of a cold, just like any other viral infection that they have, and they seem to bounce back very quickly. Some of the seroprevalence studies which were done last year among children showed that 60 to 65% of Indian children have already been infected. And given the fact that the children's hospitals were not overwhelmed, suggests that most of these children, therefore, had a very mild course. So I think this is very reassuring, and parents should constantly remind themselves that even if their children do get infected, it is very likely going to be a mild infection. Now, when it comes to school reopenings, we now know that prolonged school closures are not good from a mental health perspective for children. They are not good from a socializing perspective. Children learn so much at school, which they are simply not able to learn at home to the same degree. Secondly, it also discriminates among individuals who don't have, for example, gadgets at home, who don't have laptops, who cannot have access to online learning. So I think it's very important to get our children back to school. And I think we can be reassured in the fact that even if they do get infected in the school, their probability of a severe infection is extremely low. That being said, I know that parents are still anxious about their children going back to school. I think the simple things that we can teach our children is hand sanitizing. I think that's the most important thing when it comes to small children, because that's possibly going to be a very strong mode of spread. Children constantly touch objects, they constantly touch their face. And if you can just tell them to hand sanitize, avoid crowds in closed rooms as much as possible. That may not always be possible. And masking to whatever extent feasible. I mean, it's difficult to mask children who are under six years old, for example, but the older kids should definitely be encouraged to mask.
And probably, masking, even if it is not perfectly fitting, would still afford a good mask, would still afford some degree of protection to the child.
Yeah, I think it's definitely better than nothing, especially when a child is sneezing, when a child is coughing, and the child has a mask on, even though it's not ideally placed, the droplets that are generated by that sneeze or that cough are likely to get arrested. So more so for the ill child than for the children around them in the context of an ill-fitting mask.
Fair enough. You talked about the mental health. I believe that, the physical health of the kids also needs, getting out into the society, both from an immunological challenge perspective and from actual physical activity. What do you think?
Absolutely. I think pre-COVID, we were already sensitized to the fact that children were getting addicted to gadgets. There was a lot of screen time being spent, and that screen time and addiction to gadgets would result in poor physical activity. I think the obesity epidemic that we are seeing in adolescents all over the world is reasonably pronounced in India as well. And I think 2 years of staying at home and being inactive and not engaging in sports, not engaging in the usual fun and activity that you would at school is likely to have a physical toll as well, in addition to the mental toll.
Absolutely, absolutely. So the next question is about masks. So as an expert, what type of mask do you recommend? Any type of mask that you would not recommend for the general population?
So the masks that really protect are the N95 or the K95 masks. They are high efficiency masks. They filter out up to 95% of the respirable fraction. Those are the tiny particles which generally are laden with virus. And if you are wearing an N95 or a K95 mask, that alone suffices. Now, it's very important that the mask is sealed well. So usually there is a metal clip that needs to be pressed firmly. When you suck in, you should feel a slight vacuum inside or the mask going inside, which would suggest a good fit. And as long as that fit is adequate, an N95 or a K95 is all that a person needs. Now, a lot of people find it difficult to tolerate an N95. They feel claustrophobic, in which case a double mask, where the inner mask could be a 3-ply surgical mask and then covered outside with a cloth mask, is a reasonable alternative. So what happens with a 3-ply mask is very often the sides remain open and you don't get a really good seal. Now, if you top that up with a cloth mask, which then gives you that seal on the sides, and you pinch the wire on top, if you make sure you do all of this, you get a reasonably good seal offering a reasonable degree of protection while preventing that claustrophobia, which a lot of people cannot tolerate.
That's an excellent point, Dr. Pinto, because that has been one of the problems. You ask somebody to mask up properly, and people do have that challenge. So I think for the audience, this would be a wonderful suggestion coming from you, and I think a lot of them are going to adopt it.
Yeah, I think it's better to wear a mask that you tolerate and is more likely to be worn properly than to wear a mask which is ideal, but you're going to keep fiddling with it, or keep having it fall off, or keep pulling it down to take a deep breath, for example. An ideal mask is the mask that stays fit on your face for the longest periods of time.
Absolutely, absolutely. Any concerns about increased carbon dioxide in the mask? A lot of people have this apprehension that carbon dioxide is going to build up in the mask and it's going to affect their health negatively. What does the science say about that?
So there are a couple of laboratory studies done in healthy volunteers where individuals have been made to wear a mask and their blood carbon dioxide levels have been measured. Now, the reason there is a concern around carbon dioxide is when you breathe out carbon dioxide and rapidly breathe in the same air, the percentage of carbon dioxide in that rebreathed air is slightly higher than that which is in the environment. However, these studies have shown that even if the carbon dioxide does increase to a minuscule fraction, that fraction is well within what is considered acceptable. So NIOSH is a body that publishes what is acceptable levels of carbon dioxide, etc., in the blood. And this rebreathing, if it does cause a slight increase in carbon dioxide, is well within that safe range. So I think from a safety perspective, when you're using masks, especially if you're not going to be using it 24/7, I don't think there should be any real concerns with regard to carbon dioxide, especially when you view it in contrast with the benefits that the mask offers.
Yes, so what I understand from what you said is that wearing the mask and protecting yourself from COVID has got infinitely greater benefit than the slight amount of carbon dioxide that rises, which also studies show does not affect your health in any adverse manner.
Absolutely. I think there's no doubt as far as that is concerned.
Wonderful, wonderful. So another question is that, given the changed lifestyle and new challenges at the workplace, how do you think the institutions, whether they are educational institutions or commercial establishments, offices, or even homes, are there certain measures that people can take as individuals or as a society or as an organization to improve the, chances of not developing COVID or maybe even other respiratory infections? COVID has kind of heightened the awareness around respiratory infections.
No, I think this is a great opportunity that we have. This is a moment in time where we can start thinking in terms of respiratory health on the whole, when we can start thinking in terms of the quality of air on the whole. Now, India has one of the highest rates of tuberculosis in the world. India is the second leading cause of death in India as a disease called COPD, which is again respiratory. And we know that all of these diseases, so disease like tuberculosis is caused by airborne germs, while as diseases like COPD, diseases like asthma are worsened by airborne triggers, right? So it would do us great good if we start focusing on ventilation, if we start focusing on masking as a way to protect individuals, not just from COVID, but from tuberculosis, from other viruses. And I think a lot of focus needs to be put on ventilation, which has unfortunately been ignored. So I think, throughout the pandemic, the 3 C's that have constantly come out is closed spaces, overcrowding, and close contact. And unfortunately, we have no shortage of all these 3 C's. We need to start focusing on ways in which we can decongest places, we can improve ventilation, and therefore prevent the spread of not just COVID, but any future respiratory virus or germ that might be out there.
So Dr. Pinto, when you say improve ventilation, so earlier, what we see in the world of movies, and some of us have worked at, these institutions which were made many, many, many years ago, and they have a different kind of a structure. But current environment or, security issues and all, we are living in slightly more boxed kind of situations, even at workplace. And natural ventilation may or may not be possible, given the situation. So what is the suggestion for that kind of a situation?
There's a lot of in terms of HEPA filters, for example. There are different filters that can be tried to improve the efficiency of filtration of the air that goes through air conditioning. So you're absolutely right. I mean, we're not going to be able to just switch off air conditioners, given the fact that we are a tropical country, given the fact that there's a lot of temperature variation even throughout the year. So we're going to have to accept a little bit of indoor ventilation as a reality. We're not just going to be able to open windows, but within that indoor ventilation, I think a lot can be done in terms of looking at filtration systems that are high efficiency and can improve the air quality within closed spaces.
Thank you. Another question is, the audience wants to ask, there are a lot of treatments that they keep reading about, monoclonal antibodies and newer antiviral drugs or antibody, cocktails. So what is your opinion on that? Who are the patients who are going to benefit with these?
If you look at all the studies done for all the newer therapies, all of the studies excluded individuals who were vaccinated. So I think the number one point that needs to be emphasized is that if you don't have comorbidities and you are vaccinated, you really need nothing apart from symptomatic treatment. So you need paracetamol for a fever, a little bit of antihistaminics if your nose is congested, maybe an inhaler if you have a cough, and nothing more than that. Now, these drugs, which are antivirals, for example, like remdesivir and molnupiravir, or the antibody cocktail, the ones that work against Omicron are not available in India yet. But these drugs are designed only for individuals who are at high risk of deterioration. So unvaccinated individuals who have immune compromising conditions as a result of which they may not have mounted a response to the vaccine. So they should be reserved only for these individuals and not for the general public.
Thank you so much, Dr. Pinto, for all the valuable tips that you've given, and the 3 C's as well. I'm sure to use it at another conversation with other people. That's very interesting. We are coming to an end towards the program, and I would like to thank you so much. And I would like to tell the audience that you were kind enough and brave enough to join us for this program, despite having been tested COVID positive and being in isolation.